Another question which I wanted to ask, like, when do the patients start seeing the effect of the surgery? And you clearly mentioned it takes a week.
It takes a week
for them.
It takes a week. It's not that you don't see anything on the first day.
Okay.
The patients are going to be very happy on the first day. But clinically, what we say is the mark of visual acuity on the Snellens that we take up as 6.6 or a 6.9, that is a 20/20 vision or a 20/40 vision. You get it after 5 to 7 days. So that's the clinical time which usually the photoreceptors take to align themselves.
Another question which I have for you, Doc, is how do you determine the size of the pinhole? Is it going to be 1 or 1.5? Like pre-operatively, can you determine that size as well?
Yes, absolutely. What we do pre-operatively is that we have a pinhole device with various gauges on it, starting from 0.5 millimeter to 4 millimeter. It keeps on increasing gradually at every 0.5 millimeter. You just have to place it in front of the patient's eye and make the patient see through that. And whatever size the patient feels optimal vision is, that you choose that size of the pupil for the patient to be created intraoperatively.
We have the leverage of decreasing the size post-operatively if we feel the need for it, or increasing the size of it. So that's the beauty of the...
Yes, definitely. You can choose the size of the pinhole that you want to create. Now, if you have a confusion, it is always better to create a smaller pupil, because you can always enlarge that pupil and you don't have to take the patient back in the OR for just enlarging a bit of pupil. But if you already have a big pupil and if you want to make it small, then you have to again take up the patient in the OR. So the best thing is, when in doubt, create maybe a 1 millimeter pupil. Ask the patient if the patient complains of any dim illumination or something of that kind. Wait for 1 week. After 1 week, if the patient complains of dim illumination or something, maybe you can just take up the patient on a YAG laser and just increase a little bit size of the pupil, and then that solves the problem.
We have done a lot of these eccentric pinhole pupilloplasties at our center with Professor Amar, and they're showing very promising results, especially in corneal scars and traumatic patients. And what do you think is the learning curve for a beginner surgeon who wants to do this? Like, how do they go about it?
The learning curve, that's a very good question. It's a technical thing. The basic requirement for doing this is that you should know a pupilloplasty procedure to be done. For us and everybody, we commonly use the single pass phototropism procedure that we described about 5-6 years back. So that's because, you can use any procedure of your choice, but we try to use that because it's simple, fast. You don't have to take multiple throws. You just take a 1 pass and 4 throws and you are sorted. So basically, the surgeon should be very well versed with handling of the iris tissue. So that's the first requirement. You should know how to do a pupilloplasty procedure. So that's a basic requirement, because when you are trying to create a pinhole, you will have to make around 4 to 5 attempts at least to close down the pupil from all the sides. So that's one thing that the surgeon should be knowing.
So ideally, any cataract surgeon, anterior segment surgeon should master this technique, because I think it helps them in all other techniques as well. Not necessarily pinhole, but any traumatic iris where they can change it. Thank you so much, ma'am, for being here.
Thank you so much. It was an honor. Thank you so much.